Hello viewers, we're very glad to have you here once again at Ascendant Hope, where we share hope, we share life, and we believe the conversations we've been having here are building you even as we grow together. Now, in the part one of this episode, we met Dr. Kendi, who was very kind to share with us her expertise on psychiatry and helping us understand depression and many other mental health issues. Now, in this part two, we continue with that sharing just to help us as a society understand mental health better and know when to seek help, how we can seek help, and how we can become a better people, even supporting each other in terms of our mental health. Welcome. And if you had not watched part one, please go back and watch so that you can be able to follow the story through to part two. Welcome.
Because I'm listening to the things that Dr. Kendi is talking about here today, and that's not common knowledge that you pick on the road. And that's why we are so grateful that you're here, that you can be able to answer some of these questions. Maybe as we talk about questions, I think the other one that has been there is caregivers for people with mental health. How, because recently I was talking to somebody and, excuse me, they are taking care of someone who's going through that, and it's very stressful for them. I mean, they are sick themselves. They have no mental issue, but just the wariness of this person today, you know, they say this, tomorrow they say this, and really trying to make sense of that. What kind of help can be given to caregivers? Or what approach do they give to?
So first of all, for caregivers, it's important to understand if you're having a mentally ill patient that you've been taking care of, this one can be a lifelong issue.
Oh, really?
Yes, sometimes, depending on the condition that we are talking about. So it's important to appreciate that you also need to take care of yourself. Because this is where now things like caregiver burnout comes in. You get in. Because now you have this mentally ill patient, mentally challenged, who does not maybe probably want to adhere even to the treatment that the doctor is even giving. You get in. So there is also this thing of follow-ups that they have to go see a psychiatrist, see a therapist, and all that. So sometimes that one can become tiring for the caregiver. The other thing that also burdens caregivers is also the monetary implication of mental health. You get in. The drugs that maybe they are buying, they're expensive. So maybe probably this person doesn't even have a medical cover. So they are stretching themselves and all that. So the one important thing to do as a caregiver is always when you go to doctors or you have a chance to talk to psychologists and all that, voice your feelings. You get in, your concerns about the patient, what is the issue, and of course from that now you might get some help out on how to handle the patient. The other thing also is now as a caregiver, you also need to practice self-care, because if eventually you become sick yourself, how will you take care of this person?
Because your stress
Yes.
might end up now.
Yes. And also you have to know your limits. Sometimes you're dealing with an adult who has the capacity to make decisions for themselves. You get in. So just work with the professionals. Don't tire yourself a lot. Yes. And if it is a financial issue, discuss with your psychiatrist or your psychologist. These days, even people can access mental health services in government hospitals. You don't have to overstrain yourself going to private practitioners, maybe, if you feel like now you're being overstretched. Sawa. Yes.
I think that is very important because I think the question of affordability has really come up. It's too expensive, so people just choose to stay at home, let me deal with it. But it's good to know that people can walk into government facilities. Yes, yes, and I think the other thing I really picked from you, which is very important, it's okay to say I'm not okay. because it seems that the one thing that people are ashamed of. I need to wear a face that shows everybody else I'm fine, whereas I'm crumbling inside. Or if I can't wear the face, I isolate myself because I don't want them to see me that way. And I think viewers, as we listen to this, and we're really blessed to have Dr. Kendi here, it's important just to be able to say, I'm not okay. I mean, let those who can help, the professionals, be able to tell you, even if you're not sure what it is, but you don't feel okay, just say, I'm not okay. And I think that is extremely important. Now, when it comes to the question of caregivers, I think you've answered that. There was also the other question of the person who is ailing themselves. I think the question that came through was, how do I share what I'm feeling without burdening people or pushing them away, and still sustain a healthy social relationship? Because the question was, do people get tired of me when I keep saying I'm not okay, I don't feel fine? Yes.
So like I said, sometimes we might assume that people get tired with us because of trying to express ourselves and our feelings. So as a mentally ill patient, that is where now you have to really decide to work on yourself. Even as the doctor is assisting you in terms of treatment, your therapist is also trying to work with you to handle maybe the triggers and stressors around your mental issue. You have to understand that people around you, they are not your enemies. Because eventually that's what now mentally ill patients now come and say, that probably everybody now hates me, nobody loves me, you're getting. So I think this is a two-way traffic, where you also have to also understand what this other person might also be going through because of what you're going through. You're getting. If it is maybe a husband and a wife, and now probably it's the wife who is sick and is always wanting this attention, and the husband has to go to work. So you have to also understand that this is also a person, and their life cannot stop because of you.
Wow, I think what I'm hearing from you is that managing the mental health becomes a shared responsibility.
Yes.
Between the person who is actually ill and the person who is supporting you. So that we don't break the person who is supporting, but at the same time we don't abandon the person who is looking for help.
So eventually now, when now we are dealing with the mental illness, that is where now, through now even psychotherapy, somebody has to come to an understanding or have insight that this is the problem that I'm having, and this thing does not mean that I am what is it? What's the best thing to use? That I can't do anything. You're getting.
Like I'm not necessarily incapacitated.
Yes, I'm not incapacitated. Yes. It means that you can still take your medication and be able to go to work. You're getting. Okay. I can still take my medication and still relate normally with people. Like mental illness will not change. Although sometimes because of the medication that maybe they are on, they are those ones who tend to maybe be slowed down a bit. But that is always good to be discussed with your doctor. If you feel like the medication you're being given is having any negative side effects, it's important to discuss with your doctor. And that is the importance also of follow-up. Even as a mentor, when I'm having this mental condition, that's why we encourage go see a doctor. And after you've seen a doctor, it doesn't mean that when now I prescribe medication today, that is the end. There is follow-up. Yes, so that now we are able to intervene if there is an issue in between. Yes, so as a mentor, when you're having now the mental health challenges, it's important to understand that now, as I said, it is a two-way traffic. Know your part, and there's also the part of now your caregiver. Yes.
Sorry, just riding on that, is the automatic treatment for depression medicine? Is there a way depression can be treated without somebody having to take medication?
Yes.
Okay.
The only point at which we medicate is if this condition now is affecting their functioning, how they are relating with people, if they are not going to work. And for example, if this person now is a risk to themselves or to others, maybe somebody wants to now end their lives or they want to harm others. That's the point at which now we medicate and even maybe probably admit. You get in. But if it is somebody who just comes in and they are just having the normal life stresses and all that, they might not need medication. They just need therapy. Yes.
Because I hear some of the medication have got very bad side effects. Somebody was telling me some of the depression medication actually makes somebody suicidal. Is it true?
Yes, there are some that can trigger suicidal behavior.
Wow. So you're being treated for depression.
But now you're put on medication that now also, yes. And that's the importance also of probably if now this illness is a bit severe, we are now able to admit this person and you have like that constant day in, day out monitoring. And by the time this person now is leaving the hospital, you are able to like assess. Are they having suicidal behaviors and all that? And if it's an outpatient setting, that's where now you set close follow-ups. You get in. So that now during follow-ups, what we do is, are you experiencing any side effects from medication?
Yes.
How are you doing? Are you able to sleep and all that? So that's the importance of follow-up. So that you can tell, yes. And if the drug is affecting you, of course the doctor is going to change. Yes. And the other thing I will say is there's this thing that people say that the drugs that we use to manage mental conditions, they have side effects. I think we need to refrain from that because all drugs have
even antibiotics, yeah.
Yes. So we cannot like just categorize the mental whatever treatment. Those are the only treatments that now can give us side effects. No. Yes.
Okay. There is another question that came up, Dr. Kendi. What is the association between depression and expression of physical illness? I think psychosomatic symptoms. Can I begin to have symptoms of physical illness as a result of depression?
Yes.
Okay. So what causes that?
Maybe we can just begin by defining now what is this. Like
that's
this psycho.
Yes, that's a big word. That's a big word. And maybe there's a viewer there who is wondering, okay, what did you just say?
Yes.
So maybe to be good for you to...
But these days we are calling it somatic symptom disorder.
Somatic.
Yes.
Okay.
Yes. So ideally this is you're having psychological symptoms that now eventually now lead you to having now sort of like a physical illness. You're getting. So for example, this is somebody who will always present with maybe headache, abdominal, migraine, probably just fatigue. You're getting. That one looks more of medical. But it's because now you are having psychological issues, but now presenting now with those physical symptoms. Yes.
But that one can only be known if it's something that is happening repeatedly. Because again, we don't want the viewers to freak out that next time you have a migraine. No. Or next time you say, my tummy has been aching for the last 3 days. And you're like, oh my God, am I depressed?
No. The only way now to determine if you're having a psychosomatic illness or what symptoms is if you find yourself repeatedly going to doctors with similar symptoms.
The same.
Tests have been done.
Yes.
The doctors can't find any problem. You've even done a CT scan, you've done MRI, you've done ECGs, you've done, name it, lab workups and all that. But the doctor can't seem to find any problem.
Yeah.
Yes. That's the point at which now most now doctors are going to refer to us. Maybe just have a check on this person who has been presenting with A, B, C, D things, and we are not able to find an issue. And when you dig deeper, you find that they are having maybe some psychological, emotional challenges. Yes.
Can I, as a patient, if I see, I've been to a doctor so many times, nothing showing with all the tests that you've named, can I just walk myself to a psychiatrist and say, could you check me out? Or I have to have a referral?
Okay, what I've seen is that most people now with the somatic symptom disorder, they tend to be referred to us now by maybe probably physicians. Because of course somebody with a headache will not come to a psychiatrist.
Yes, they'll go to a GP. They'll just go to
GP.
Yes.
You're getting.
Yes.
But now this GP has treated this headache for so long, and this person does not seem to improve. You're getting. So sometimes these people will not come to us directly, but they will come maybe through a referral. That is why now, also now our GPs and the other healthcare providers have also to be empowered to recognize such things. You're getting. Because now you find that we lose these people because they will not come to us. They will just go maybe to just normal GPs. You're getting. And this GP will just decide, this is a headache, let me give painkillers. And you find that eventually this person now even becomes addicted to painkillers. You're getting. Yes.
Because now, I mean, you know, I'm just looking at the question you're asking. Not everybody will be free to wake up and go. And now you're waking up and you're going to see Dr. Kendi, a psychiatrist. I think it's what is it called? It's almost considered like, if people hear you're seeing a psychiatrist, it's almost, what is the word? It's considered a what?
It's like a taboo or what? Not taboo. Not taboo. It's
okay.
I'm mad.
Yeah, you don't want people to think you're crazy. You're losing it. Yes. You know. So kind of like everybody would want. People would want to keep it. You know, quiet. That even if I went to see Dr. Kendi here, I would not want other people to say. So probably that's why patients cannot take themselves. Because I think there's also you're trying.
From what people know, somebody who has a mental issue or mental illness probably must walk around maybe barefoot and collect things
and naked and all that.
Look all unkempt and all that.
Yes.
For us to say that now this one is a mad person. But these days, you don't have to do all that to be mentally ill. Wow. Yes.
You can be looking nice, a good professional businessman wearing a suit, but you're actually having mental issues. Look at that.
But I think that is where then as a society we need to educate ourselves in terms of what exactly is mental illness, so that we don't treat it as she's saying as people are crazy now, people are mad, and therefore they feel stigmatized.
Stigma. I was looking for the word stigma.
Oh, I didn't know.
I was looking for stigma, not taboo. Stigma. Yes.
Yeah. So they are feeling stigmatized. And now I just want to throw that back to you, Dr. Kendi, because do we as a society understand psychiatry? What do psychiatrists do? Why are we so terrified of showing up at a psychiatrist's door? Maybe if we understand that better.
And number one, psychiatrists don't read minds. You know, people believe that when you go to a psychiatrist,
please.
Educate us. That one is just the normal language that people use out here.
Yes.
But a psychiatrist is just a trained medical doctor that is trained to diagnose and treat mental conditions. Yes. And so I usually tell people that we need to reach to a point where visiting a psychiatrist needs to become a normal thing, like just going to a physician or a surgeon. You're getting. But you see now the downside now with mental issues is that I don't have a cat that people can see. So
my back is not aching.
Yes, my back is not aching.
Yes.
Like the psychiatrist, even if I go to somebody and talk to them, how are they going to assist me? You're getting. Yes. But I think it is important that now we have a lot of this education and maybe such forums to be able to just educate people on mental issues, so that now we demystify this thing, mental health. Yes. because I think in this time and age, everybody might need to see a therapist, even if not a psychiatrist. But at least I'm having something that I think is not okay with me. Yes.
What's the difference between a psychiatrist and a psychologist? Yes, I think there's a confusion there.
So now a psychiatrist, as I said, now is trained now to diagnose and treat. Like you're getting give medication. Yes. Okay. But now psychologists, they offer therapy, they do counseling. You're getting, it's like now the way a surgeon cannot work without people in theater to assist them. It's the same way
and all
that now you can look at it as look at a psychiatrist and a psychologist. So once I've seen that patient, this person is having challenges, is having maybe a broken home and all that. Medication might not repair that, but talking to a psychologist might ease the issue that you're going through. So generally that is it. That's the difference.
So to the psychologist now, they'll go for sessions of counseling.
Yes, they go to sessions. And of course now as psychiatrist and psychologist, we work closely. You're getting. Okay. Because now if I'm seeing this patient, I'm also supposed to be able now to talk to the psychologist and be able maybe to just tell them that I saw this patient, they are going through this and this, just address these areas. Now when this person goes to the psychologist is also supposed to communicate to me and tell me this is what I found out and all that. And that one will also help me now do proper care. Yes. Okay. So you find that people, when they come to psychiatrists, they might not disclose issues as it is, but when they go to psychologists and they have a good session, it's a longer session, they are able to disclose things that maybe the psychiatrist, they may not have been able to tell me. Yes. Okay. Yes.
And Dr. Kendi, what is bipolar? Because bipolar is also another very mysterious, and nobody wants to be known that they have bipolar. It's also, you know, stigmatized. It's also a lot. What is bipolar?
So bipolar is also another chronic mental disorder. Ideally now, the bipolar is opposite of depression.
Opposite.
So it's actually almost opposite in terms of now the presentation. So this is a person now will present with extreme mood swings and maybe overly talkative, talking a lot. They might even be having destructive behavior. They might also be grandiose. What we say, they are having an inflated sense of self-esteem. So this is somebody who will say, mimi hata ninajuana na Uhuru Kenyatta, and maybe they do not even have any association with Uhuru.
Wow. What did you call it again? Inflated, what did you call it?
Self-esteem.
Inflated self-esteem.
Yes.
Okay.
So they present as these big people. You're getting. Like now I have a patient in the ward, I will not disclose more details, but this person will say that ni mimi ninapeana kazi, I'm going to sack all of you and all that. So they have this sort of like behavior that is out of proportion. You're getting. Yes, and then the other major thing with bipolar is that they have this thing we call decreased need for sleep. So this is somebody who will sleep maybe for a few hours, then maybe probably wake up very early in the morning and start doing things. They are washing, they move from one thing to another, so they have.
Are they aware?
They are not aware.
And so is it like, are they sleepwalking at that time?
No.
They are not sober, they are awake?
Sober. They are awake, yes. But now it means with now bipolar, they can't control their mood. They overdo things. You're getting? Yeah. Yes.
At what point, as a patient, because I could just be thinking, I'm not having enough sleep these days, probably I'm working so hard, or it's too hot these days, I can't sleep enough, and I'm generally active. At what point do I know I need to go and see a doctor?
At that point, these are people now who clearly they don't even think they are sick. See? So it's others who are going now to notice that there is something off with this person. somebody who is used maybe to be just conducting themselves with some decorum, all of a sudden is just talking, maybe sending messages on social media, just maybe abusing people, you're getting it. So of course now that is bipolar for you. Yes. And they have this sort of like, the mood now is not sad, they are extremely happy.
Yes. Because depression,
But
they are very sad.
Yes, they are
bipolar,
very sad. Yes.
they are kind of like hyper.
Yes.
Okay.
It is, they are hyperactive.
Yes.
Yes, that's the name.
Wow. Wow. But they also have to be put on medication.
Yes. What we call mood stabilizers.
And that medication is different from the one for depression? Or
It depends, because now you see bipolar is on a tool. The way you hear bi, it means two. So it's either you're manic, now that is now what we call bipolar, manic, or sometimes you could be on the other side of now mood, you're depressed. You're getting, so that's why it's called bi. So it's either you're having a manic episode or sometimes you present with a depressive episode. So somebody actually who is manic can all of a sudden now shift to a depressive episode. So now when we are managing patients with bipolar mood disorder, that's why sometimes now our consultations take time because we have to make the right diagnosis. The moment you diagnose somebody who has bipolar and you say this person has depression, if you put them on antidepressants alone, you shift them to a manic episode.
Wow.
Yes.
Wow.
Wow.
Question. In this manic episode, other than just being happy and overly active, can they hurt someone?
Yes. They can be suicidal. And also homicidal. Suicidal, that is now harming themselves.
Yes.
Homicidal now is harming others. Recently, I have a bipolar patient who recently, because he was slapped by a man in their office, just walked into the office with a knife and threatened that person.
Wow. So the bipolar person walked in with a knife.
Yes.
They want to harm this other, a colleague.
In a huge organization, okay, like this. And just walked in with a knife and put it on the table. Yes.
But that's what his emotions or her emotions are telling them at that time.
Her emotions. Eventually now when I'm talking to her, she's telling me I was feeling angry, I was feeling...
Oh, it's even a woman?
Yes.
Oh my goodness.
Let me ask. I'm concerned here, Dr. Kendi. Now, where do we draw the line? Because as the employer, maybe the first person they call is the authorities, the police.
Actually, as we are speaking, the employer now is sort of like going towards the side of interdicting her. And now that is why she's in hospital, because now when the mother now recognized this, she brought her to hospital. Now what the employer, of course, they know she's been having this, but sometimes people are not able to like differentiate. Is this person acting because they are sick or... Yes. Right. So that is now where psychiatrists now come in, and we are able now to provide our expert opinion and say that this person acted like this because they were sick.
Thank you, because I was asking myself, if that person is thrown into jail, then we are putting them in a much worse situation than they were in before because they were not in control of self. All right. So that's why you come in as a doctor and say, no, this one is my patient.
Another example also of a bipolar patient who recently had issues is a patient I've been managing, a lady also. Yes, bipolar tends to be more common in females, of course, and also depression. So I've been managing her for a while. So all of a sudden now she loses her job. You see, she has children to take care of. Now, because of all those stresses and whatever she's going through, she beats her child severely. Wow. So now the relatives just take a video of what she's done and they go now to our children, whatever. Okay. Yes. Wow. What the children office now do, they come with police. This lady is locked up.
And they take the child.
Yes, and they take the children. Now, as we are speaking, the children are in a children's home. Wow. This lady has gone through hell in prison. Wow. With people who don't even understand where she's coming from. Yes, but eventually she's been released on a bond and the case is still going on. So recently she came to me and she was telling me, Daktari, I'm tired with life. And I was telling her, you need to continue taking your medication. We have done our reports. She even went for a mental health assessment in Madari Hospital, where now the doctor also just said that she needs an admission and she needs to be taken care of and offered psychosocial support. But this one was even ignored by the same people who are supposed to help her.
How soon does a doctor like Dr. Kendi get involved in such cases?
Yeah, I was just thinking about that.
Yes, so we can only be involved now, because this one is now a case in court, when now the court orders this person to undergo a mental assessment.
That's when they get
That's when now they come to hospital and we do our own assessment, and now it's taken back to court.
Okay.
Yes.
Wow. I think this is a lot of education. A lot of education. And I hope, viewers, that you're gaining a lot as we say this, because I think when we started this conversation earlier and we realized so many gaps, we were hoping we could get an opportunity like this. And thank you so much, Dr. Kendi, for that. And really, I think importantly is to be able to know I can say, I am not okay. All right? I'm not okay. Number two, it's not shameful to ask for help. Yeah, it's not shameful to ask for help. That you can say, I need this help. I don't know what is happening with me, but I don't think I'm myself. I think the other thing that struck me when you spoke, you said the thoughts we feed ourselves with consistently might lead us to a mental illness, because stresses will be there. So I think even having the care of how do I interact with the circumstances that I'm facing, how am I allowing my mind to process what is happening to me at a given time? Because we've been talking about giving hope here with Christine, and we are consistently talking about processing your experiences in a way that allows you to see an outlet, to see hope, to see a place where you can actually beat this or overcome this. And thank you so much for bringing that out. I think it's been really, really profound. I just hope, Christine, that as a society we'll get to a place where we can treat mental illness like anything else. I don't see why I should be so comfortable to go to a doctor and say I've been suffering diarrhea for 3 days instead of simply saying I think I'm disturbed by so, you know.
Yes. And yet people are going through that. I mean, mental illness is on the rise.
Yes.
And whether it is termed as such or not, it is still there. The fact that it's not called that does not mean that it's not there. And, you know, sometimes you listen to people and somebody talking about this. And I remember a guest that we had was even telling us that one time she got a phobia for water. She could not even, you remember that?
Yes.
She could not even, I mean, she couldn't, water would just send her into a panic attack. And doing basic things like, you know, just mixing tea and stuff like that. And so that got me wondering, does mental illness present differently in different people? Like, you can't say mental health presents this way. It's not a straight line. This one will present this way.
It's not a straight line. It is not a straight line. Like, you can have a series of patients with depression, but they are all presenting differently. Or have a series of patients with maybe even bipolar, and they present differently. Yes.
Wow.
Yes. So this is where now, even as the doctor, you cannot like be very fixated that this is how it presents. You have to be open-minded. Yes. Otherwise, you're going to end up mismanaging people. Yes.
Thank you.
The other thing I would say is that sometimes also you know, the public, people don't really understand what really psychiatrists do. So sometimes they want to know what diagnosis does this person have at the initial consultation. So what I usually tell people, sometimes the mental presentations keep on changing over time. So somebody can come in with just an acute, what we call an acute psychotic episode, maybe a brief psychotic episode. Then all of a sudden now along the way, we are diagnosing them with even schizophrenia or schizoaffective disorder. You're getting. So sometimes you might be given this diagnosis at point A. When you come back again, it is something else. You're getting. So that's where now the confusion also arises. And people also start seeking for second opinion. I want to get somebody else to tell me if this is what I'm having, and maybe even a third opinion. So sometimes it's important also to give your doctor time to just assess you over time. You're getting? Yes. Okay. So we may not be 100% correct at first, but eventually, with time, working with a psychologist, we will get to the exact diagnosis for your condition. So hii si kama ile unaenda unapimwa malaria pale unaambiwa mental health is different. Totally different. Yes.
Yeah. So it's a journey.
It's a journey. It's a journey.
Wow.
Yes.
And you mentioned that sometimes this can even be long life.
Yes.
I mean,
yes.
not long life.
Lifelong.
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 It can be lifelong.
It can be lifelong.
It can be lifelong. And for some other people, it actually they are able to.
And that's where now the problem comes in, because now you see with our patients that we manage, they tend to think that now because I've taken these medications for maybe 1 year, now I'm okay. You're getting, but they don't understand that this is a chronic condition, that you need this medication for you to function well. And the moment you are off the medication, you're down.
So what you're saying, Dr. Kendi, is that it is possible to get medication
Yes.
and go on with your normal life.
It is possible.
You'll go to
but
work,
this one
you'll
does
do...
not apply to everybody. Let me just put it plainly.
Okay.
Because there are people who that might come in, maybe it's just a postpartum issue, or maybe a small stress that they are going through. And it's something that can be sorted within a few months down the line, and they are off treatment.
Okay.
You're getting. So this is not for all category of mental conditions, no. But conditions like bipolar, schizophrenia, schizoaffective disorder, these are chronic conditions.
Okay.
Yes.
And schizo, yes. Those are the two. Please define them. At least now you have demystified bipolar.
Yes.
Please demystify the
Yes.
others.
And by
Those
that
are the two.
I said that bipolar is like the opposite of depression. Maybe let me correct it a bit, because it's like the manic episode now is what is the opposite. The way a manic patient will present is just the opposite of the way a depressive patient now presents, almost in a few of the symptoms.
Okay.
Yes. So now schizophrenia, okay, the way I will now define schizophrenia and schizoaffective is that these are psychotic conditions. What I mean by psychotic, these are people who present with probably they are hearing voices, what we call hallucinations. Getting, they are delusional, they are having abnormal beliefs. Is that okay? Like what you were asking me before we started, this person who thinks that there are people following him or following them, that is what we call now paranoia. So ideally now the schizophrenia and now the schizoaffective, they tend to like be almost similar, but not similar completely, because now schizoaffective, you're having a combination of now schizophrenia symptoms and symptoms of now affective disorder, either bipolar or depression. You get in? So that's why now it becomes schizoaffective. So schizophrenia now you're having delusions, you're having hallucinations, disorganized behavior, and maybe disorganized speech. You get in? Sometimes there are people with schizophrenia who now present in a catatonic state where now they can't talk, they can't feed, they are just
Cannot.
there. Cannot.
Wow.
Yes. So ideally that is now schizophrenia and
that is still
schizoaffective.
mental health.
Yes,
They
it's
can't
still-
talk, they can't feed, they can't do anything for themselves.
Yes, they just maintain certain postures. They can stay in that posture for long without moving.
Oh, wow.
Yes. So
Is that an advanced stage of illness or what is it?
it's not like an advanced stage,
Yeah.
but it's just a presentation of now schizophrenia. Yes, it can present with now catatonic symptoms. Yes, and
Catatonic.
catatonic.
That
So of course now what it means now catatonic is that you're having, how do I put it simply now? In terms of now your movements, let me put it like that. The body movement, and now the way we are, somebody's supposed to behave normally, they just look off. You're getting, this is somebody you're trying to talk to, they're just looking at you. They can't talk. Yes.
But can they hear you?
They hear you very well.
So is it inability to respond, or they don't want to respond?
Sometimes they are not able to respond because of the condition itself. Yes. So that one also has its own different management. Now when it comes to us managing now that kind of schizophrenia, where you're presenting now with catatonic symptoms.
Yes.
What it looks like, Daktari, it's like we need more episodes in future.
We need to bring you back.
To break down mental health.
Because now
Because it's, it seems it's quite expansive. But thank you so much for effectively addressing depression, because I think that was the key question that was asked, and even expanding it to all these conditions. And we believe it has been gainful. Even for us here, we've learned a lot. I think it's a lot of education. And hopefully, even those who need mental health will be treated better in our society, so that we're not pointing at them, as Christine said, that crazy person. So as Christine takes this home for us, as we end this, I just want to register my appreciation, Dr. Kendi. Thank you so much. So Christine.
Thank you. We really appreciate. I think, like Eva has said, we have learned a lot, and I'm sure that our viewers that are listening in have really benefited a lot. And we want to encourage you to keep on sending the questions, because we have people like Dr. Kendi who would be willing to answer questions. So if there's an area that you feel you still need further clarification on mental health, please reach out to us. You know how to get us on social media, on the YouTube channel, and you can be able to ask your questions. Our email address, you can be able to ask us, and we'll definitely get Dr. Kendi and others who will be able to come and continue demystifying this. Finally, I want to let you know that don't suffer alone. Don't sit there in your house ashamed or wondering what to do. There is help. And there are people out there who are willing to help you. There are people out there who are willing to journey with you. And we want to encourage you that just reach out to somebody and say, you know what, I need help. I feel this way. I feel I'm tired. I feel fatigued. I don't know what to do and stuff like that. And I can assure you that you will be able to get help. And above all, God loves you. And God has a good plan for your life. And when we cry to God and ask Him to help us, He says, you know, call unto me and I will answer you. And I will show you great and mighty things that you do not know. So I want to encourage you that reach out to somebody physically, but at the same time, let's learn to call on the name of the Lord, because God is a good God and He loves us. So with that, we want to come to the end of this episode. And definitely, Dr. Kendi, when you're available again, we would love to have you to come.
And maybe where can she be found if our viewers would like to reach her?
By the way, yes. Somebody out there is saying, I like that doctor. Yes. I would like to consult her. Yes. So please let us know, let the viewers know.
So as I said, I'm based in Thika Town. I have a private practice, Trinity Wellness Psychiatric Clinic. You can be able to go to our website and be able to reach us. Our contacts are there. You can also find me at Avenue Hospital, Thika, and also at Thika Level 5 Hospital. Yes, thank you.
And the name is?
Dr. Lynette Kendi, or Dr. Kendi. Ideally, that's what
everybody calls you.
Yes,
that.
That's the
okay.
Yes, Dr.
Okay.
Kendi.
So please feel free to reach out to her, and I'm sure that you will get the help that you require. So for now, we have to come to an end of this episode. It has been wonderful. Wish we had more time to talk, but I'm sure we'll get another opportunity. Yes. And from all of us, we just want to say, keep strong, keep looking up. The best is yet to come. Yes. God bless you, and bye for now. Remember to subscribe. Yes.